All right, well, we are here in facially generated treatment planning, and part of that course is looking at how we can use digital templates to do treatment planning. And we're here with a live class, and I am presenting this. I'm going to play a little bit in PowerPoint and in Keynote. First thing I'd like to get somebody to do, Kevin, if you could push number 2 back there to shut off some lights. I'd like first to touch a little bit on image management. Greg touched on this a little bit for you. But one of the things that you want to think about in image management is even if you don't have a place or a program to put things in, it can be as simple as putting them in folders. One of the most important things is don't store them in your practice management software. It takes up lots and lots of memory and actually will make things run more slowly. So what we recommend is that you just put a patient folder, like he said. I'm going to add one thing that can actually get you started in organizing. Then I have names for the patients and then dated folder for each time with any photos that were taken. And I put things like IX, which means initial exam. That's the first photos for that person. If I do a search for a folder, it'll look up every folder that has that. And as I go down, it'll show me what patient that is. Okay? Good? And then inside there, I would have a number of images specific to that time, that visit, that I could always go back and use. Specifically, initially, I'm going to use the pictures we took at the initial exam. Do you save them flipped or unflipped? Doesn't really matter. If you've taken mirror shots, just have a protocol. My protocol is always to save them in my database the way they were taken. So all of my occlusal shots are going to be upside down. All of my side shots are going to be flipped and need to be flipped horizontally. So although that looks like a nice picture, that's actually what the patient is. I know that because I know I always store them that way. Okay? If you are going to use templates on a Mac, I would recommend that you use Keynote. You could use PowerPoint for Mac, but PowerPoint for Mac is not PowerPoint. It is different. And it won't do all of the same things. The instructions that I've put into the PowerPoint folder are for using PowerPoint on a PC because it is different than it is on a Mac. Okay? So if you're going to use a PC, get PowerPoint. The beauty here is, in many offices, what I hear is, well, I personally like my Mac, but my office runs on PowerPoint. And so if I want to use it at the office, it has to be a PowerPoint. Excellent. All keynotes can be exported as a PowerPoint. They will work perfectly in PowerPoint, and you can have it in both formats. Can't do that on a PC. It will not open or run a keynote. Okay, you'd have to export it as a PowerPoint. Okay? Excellent. So I'm going to switch gears here and pull up some things on the screen. I'll switch to my auxiliary video and go 16:9, and we'll hope everything comes up real nicely. Okay? There we go. Okay? You are now looking at the screen of my Mac. That's what you're seeing up here. Okay? In the middle is a folder, and I know it's little, but it says Keynote underneath it. On your disk that you were given, that disk, there is some folders in there. One of them says Keynote, one says PowerPoint. If you use Keynote, then I would argue just open this up and drag that whole folder in. If you open the folder, there's going to be some stuff in the folder. There is an EFSB Master Keynote 16.9. That's the one we're going to use. There's also one from 2009. I actually have some 2009 ones, and that's because some models of Macs will not run the newer software. We are going to use this one, which is the Master Keynote, and I'm going to open that up. So in this, what you'll notice is, if you look at this, and by the way, for those on Facebook, these are available to you because we can send you a Dropbox link. You guys have them on a disk, but if you ever want them not on the disk, you just email me and I'll connect you with a Dropbox link that has all this stuff in it. I want you to notice that this one has been created with 18 images in it. And those are the 18 images that we recommended that you take as a full series of imaging on a patient. You'll notice, as I said, I store all mine upside down, so these are upside down. When you flip them, you may do your collection a little bit differently. Okay? That would be your protocol. Those are the 18 pictures. The beauty of this is that now that you know the 18 pictures, anyone on your team can look at this and know the 18 pictures, which means that they could actually put them into this and create a file for you if you wanted to do that. And in fact, in many offices, the protocol is that the team takes a lot of the images and they just put together a file, and that's what you get with all of the images in it. to do that in Keynote, what we're going to do is we're first going to duplicate our master. To do that, we have to go to File, Duplicate. And by the way, for those of you who are here and for those of you listening on Facebook, on your disk and in the Dropbox is a PDF with full written step-by-step instructions for everything I'm going to show you. And the reason I did that is that most of you don't operate a two-screen system. If you had two screens, it's real easy to put up a PDF and then do something. I don't know about you, but I have had the experience of going onto the computer and it's giving me directions to do something on the computer. Yeah. How do you do that? You have to go back and forth between different screens and move things off. It's really hard. So I printed it. If you do work two screens or have a giant screen, you can actually put up the PDF. It's the same thing you have printed. However, for your convenience, we printed it. In the Dropbox, it's the whole PDF, and that is also on your disk. Okay. Once this is duplicated, I now have two of these. This one says copy right up here. Okay. I'm going to close the previous one because I'm going to keep that as my master. And I'm going to label this one. I'm going to save it. When I hit save, it'll say, what do you want to call it? I'm just going to call it test, and I'll let it save in the Keynote file. If it was a patient one that I was really doing, I would like to go look for the file folder with that patient's name on it. That's where I always store these. I just pop it in there so that it is in there. In my system, I keep all of my patient images on a separate hard drive that is then backed up actually in two different places. But I carry around a drive with me, a 1 terabyte drive that has patient images on it. Actually, I'm running out of space. I need a 2 terabyte drive pretty soon. The reason for that, again, is that it takes up tons of space. And so I find it easier not to have it on my regular computer because I have lots of other stuff on there. But you may have plenty of room to have them. And if you have a system in the practice, what you're going to want to have is probably a place where you set aside a partition or an area on the hard drive where you're backing up all of that imaging. Okay? Good? So I'll save it. And now, although it is pretty nice to look at pictures of Janina, that's not the patient that we're doing right now. And by the way, somebody asked me one time, why do you have pictures of Janina in here? When I made this file, this is a true story. When I made this file, I had 2 folders with patients. One of those folders was of me as a patient. The other one was Janina. So you should all thank me. Okay. Now, as pleasant as they are to look at, that's not what I need right now. I need pictures of my patient. So in Keynote, the way that I would load the images in is, did you notice this morning when Greg was loading in his images that when you load a file into a Keynote or a PowerPoint, that a lot of times the picture is bigger or smaller? Did you know why that is? It's because of the resolution of the image and the resolution of the program. Because you can set up the program to be any resolution you want. When you do that, those two have to jive. If you've ever loaded them in, you know what a pain that can be. So what I've done is that all of these images are designed as media placeholders. What that means is that if you drag another picture into this picture, it doesn't matter if it's 5 megapixels or 5 megabytes. It will always exactly fill that frame, which makes it way easier and way less hassle. So it doesn't matter where you got the image, it'll fill that frame. Okay? So here's what I'm going to do. I'm going to go to a folder over here on my desktop that says Patient Photos. And as I told you, I have a folder that I just have folders by name. Let's go down and look at, I think probably Chris, I've used this before, but right there's his initial exam photos. Okay, it's this little folder here. If I open it up, I'm going to see a whole list of images. This is what it looks like under list mode. And under list mode, what I'm going to have is a whole bunch of numbers, because the camera assigns a number to each file. Okay? That's not helping me. In Keynote, if I come over here at the top, there's a little thing that says View. The first thing in View is icons. If I click that, it's going to show me the pictures. Now I can pick the image that is his full face smile. And I think you can see that right here. If I left click or click on my pad, and hold it and drag it over, the blue line around that tells me it's a media placeholder. As soon as I let go, it will replace that image with that image, and it will exactly fill the file, fill that frame. So it makes it real easy to drag these in. So the next one I would do the same thing. If I know that I want his smile, oops, I should have gone down one, excuse me. And then actually what I could do, I could get this out of the way and make it a little more convenient because I don't need a big picture there. If I now know I want this one here, okay, and you can see how easy it is to drag these in. I would drag all of those in. As soon as I was done, I would now have all 18 of my images. I'm not going to drag every one of these in because you get the idea of what I'm doing. I will drag one of his front teeth in there. Let's do this one. All right, for him. I know it's up here. Let's come up to this, and we'll put this in here. All right? Because sometimes I would still want to crop, so I'm going to show you how I would do that in Keynote. Let's close this, because now let's imagine we have them all in there. I would tell you that my personal protocol, once I've loaded them all in, is to leave them up there and drag them down, copy them and drag them down to work on them, so I always have all my originals available to me. That's not necessary, and a lot of people don't do that. It does take up a bit more disk space because I have lots of multiple images in there. So that would be a personal decision. The only reason I do it is that it leaves me with all 18, and I know I still have originals in case I want to go back and look at how I took that picture. So if I decided that I wanted to do something here to crop this, in Keynote, if I click the image and select it and I'm on Format, I can go to Image, and it will say Edit Mask, and that's what cropping is in this. And now I can begin to crop things, move things up, just like in any other program and lots of places. You can crop whatever it is you'd like out of the image. Okay, and then you can move that image once you've cropped it. If you want to make it bigger, you just click off, but have it still be selected. Now I can make it bigger if I want to. Okay, let's go back here and look at one other thing, because one of the things I often have to do, one of the things I try to do with my new patients as I meet them is I try to decide, do I think their pupils are parallel with the floor? If their pupils are parallel with the floor, by the way, to do that, you have to meet them standing, and it's really convenient if you get them to walk towards you. Because when you walk, you level your head. Okay? If they're level with the floor, what do I know about this picture? It's canted. So I can correct that. I could go and grab a line or an arrow down here. I'll show you all those in a moment. There's a slide here that has lines and stuff. In fact, we'll do that. We'll copy a line. Command C to copy the line. I can go to the picture I want to put it on and go Command V. I can grab an end and stretch it out. What I could have done is gone up to a shape. Okay. There is let's see if it's a parallel line. Let's go to 0. I think this might be the line is goofed. That's angled. So actually there is a glitch in Keynote. And the glitch in Keynote, I've already told Apple and they know about the glitch. I'm going to get rid of this line. That line, because it was drawn in before, actually will give you 1 degree off if you believe Keynote. And I know, isn't that interesting? I contacted them and they said, yeah, we know it's a glitch. If you come here and you want to do a line, you click here and it'll let you draw a line, and this one usually actually works. That's 0. Now it's telling me 0, and that's a horizontal line. That's following. So that's the glitch. If you had an existing shape, some of those shapes will give you some wrong numbers. So this one, it's at 0. At 0, what do I know? Where should both pupils be? So I'll kind of go in the middle. I'll come over here to Arrange. I'll hit the picture, Arrange, and down here I have a thing called Angle. It's going to let me angle the image. So I just can tip it. Now, what do I know? That's how he is in space. If I want to use imaging to diagnose and do aesthetic stuff and then plan, I'd like to know where his face is in space. I want to know where the teeth are. So the way you find out, the way you deal with where the teeth are, I'm going to copy this. You see that I selected the image, or I'm sorry, the slide up top. If I hit copy, Command C, Command V, I'll make a duplicate slide. Now what I can do with the duplicate slide is I'm going to view it as much smaller. I'm going to make it a 25% view, so I can click on this picture and make it huge. Put his teeth in the middle of the slide. Now go back to fit my window. Now what I can do is I can pick any 2 spots on this image. So I'll start with the canine on the patient's left. I'll take the right side and I'm going to come up until I'm on the canine on the patient's right. Okay? And now that line will allow me to go to any close-up image that shows those two teeth and correct that image. So I know I have that corrected in a place where I couldn't see his eyes. When would that be? Retracted, teeth apart, which is the most common image that I will draw on. Remember, that image needs to be taken at the level of the occlusal plane so that we can use it. Okay? But that's how I would correct the image. Okay? If I wanted to draw, so actually let's draw around Janina's lips. If I wanted to draw, what I do in this one is I go shape, draw with pen, and what I can actually do now is pick something to follow. And in this case, I'm actually going to go Control Command X and change that. I'm going to escape because I went down too far. I was drawing something different than anticipated. I go right to where the commissure, where lip meets lip, and now what I can do is just draw along the lip. So I'm clicking as I go, and I just create a shape. If I wanted to draw all the way around, if I double click, it will end. If I go Command Z, it'll go back one, but I probably can't add to it. I would have to start over. You get the idea? Once it's done, if you click off of it, okay, if I double click, I can now go in and select it, and then I could pick what color I wanted it to be. If I hit Style, it'll let me pick a color over here, so I can make it yellow. If I wanted to do that, I could draw along the occlusal plane, which I'll show you in a little bit, and then I could move that line up and down. If I wanted to put an arrow in to point out a chip in a tooth, so let's take this out. Let's get rid of that. I could come up here to shape, and I could get shape and put it in. Or I could go down to my slide that has those things on them, and I can just pick an arrow. Command C, that's to copy it, bring it back up, and paste it in. And then I can put an arrow here that could talk about the chipping. So I can put things in that would allow me to point things out to the patient if I wanted to by having the slide as a backdrop to our discussion. Let's see where front teeth should be. So I am actually going to correct this image without, although I have my line, don't I? Let me go back to my line. Let's correct that image and come back to this. I'll put it in here. And to correct this image, I need to go to the canine. So I'll go a little bit kind of between where I think that is. Click on that. Hit arrange, and now what I can do is I can come right here, and actually that's going to be pretty close. Actually, I'm going to go one more. Okay? I'll usually leave my work, so I'll just duplicate the slide, and then I'll get rid of this. Now, if I want to put in where I think I'd like teeth to be, let me tell you that if I look at gingival margins for Craig, it looks pretty good. He wants his teeth to be longer, his front teeth. And if we look at the buccal cusps of his premolars, we can see that the incisal edges are apical to that, aren't they? Okay, and one of the rules is, you know where the least length you want on maxillary central incisors? Buccal cusp tips of the maxillary premolars. If they're shorter than that, it looks like a reverse or a flat smile to us, and we notice it. So let's say that I want to figure out where teeth should be. Let's go get some teeth. If we look at these, I'm going to go over these in a bit with everybody. For those watching on Facebook, let's just say there's a number of different slides that have different shapes and different things. These are all the teeth. These are the originals. We used to use those 6 teeth. I drew this probably about 8 years ago. We've been using it ever since. And then several years ago, what I learned was that with these, if you're clicking the shape, you have to click the line, and it can be kind of a pain trying to move things. So I actually put together a set that is partly filled. So these you can click anywhere. I've included a couple implants, because as part of the process, you might pop an implant in. Say, I think I want to do an implant there. Now remember, this isn't about precision. This is about thought. So let's change Craig's 6 front teeth. I am going to hold down the click. It's a left click. Anything I touch with a rectangle as I drag in Keynote will be selected. I'm going to copy those. Command C. I could have gone to Edit Copy. I'll go back to the picture that is corrected and I'll paste them. Command V, there they are. Okay, I can now take this and do whatever I want with them. So I usually kind of center and put this where I think I would like to have incisal edges. So I'm going to go about there. Is that okay with everybody? Okay?
We have a question on the Facebook.
We have a Facebook question.
They want to know if you're going to talk about PowerPoint.
Am I going to talk about PowerPoint?
Next.
It is right here. I am getting there. I'm going to show you how to do things in PowerPoint. Actually, most of the things that I'm doing in Keynote work exactly the same way in PowerPoint. I will show you the differences. That's going to be how I will end my demo, okay? So what I would do now is I put the incised ledge where I'd like. If I click off of these, I can now individually size them. If I grab a corner, it will let me move like this. By the way, exactly the same in both formats. I put the gingival margin where the gingiva is. Okay? So in this case, actually, I was pretty close to where the teeth are. Gingival margins are right like kind of here. I can move one out, come here. You all get the idea? This is not about precision. It's actually about getting an idea. Now, I just did something I didn't want to do. Everybody see what I did? Yeah. Dang it. Don't you hate when you do that? Okay, there's a neat little thing. It's called Command Z or Control Z in PowerPoint. And what you wind up doing is you undo whatever you just did. It always happens if I click and I didn't really grab what I thought I was grabbing. Okay, so I'm not going to spend time. You all get the idea of sizing those? Because here's what I can do next. I'm going to leave these undone. I'm going to duplicate that slide, and I'm going to get rid of the picture. So Command X. Now I am not distracted, and I can set proportion. And I would tell you, just believe what you like. I like long teeth, so I'm going to make this teeth a little longer. I kind of like those. Okay? Keynote will actually tell you the ratio, but I would tell you I never even look, ever. My technician is going to measure it. I just want to see what would that look like. I want to get an idea, and what would I have to change? So actually, just to illustrate the change, I'll show you. Let's say that I really wanted to have some big, prominent central incisors. I will come up here just to do this, just so it looks better. And all I'm doing is dragging. Okay? So let's say that I decided that this really is what I think I would like, so it looks better in his face. The next thing I would do now is duplicate the slide. Let's put the teeth back. To find that, I'll go to the picture of the teeth, select it, copy, Command C. I'm going to paste it in, Command V. I just pasted it over the slide. Anytime you paste anything into a slide, it will go to the top. Let's move it to the back. When it's selected, if I am on a range, I have choices here: back, front, backward, forward. Back sends it all the way back. Backward sends it one step back. I want to go all the way to the back, so those are on there. It now illustrates for me all the soft tissue difference I want and the hard tissue difference I want. What does it not tell me? How I can do it. Okay, but it tells me what I want. Now, the ways to do it, though, can become margins as you see them. What are my choices for moving free gingival margins? Ortho-perio. Great. Those are my choices. How do you decide? You look and you see, where's the papilla going to wind up? What's the papilla look like? How would this look like a nicely proportioned tooth with a 50-50 papilla split, which is usually the number we kind of aim at? That's what you would do, okay? If I took a picture that was not flipped, to flip it in Keynote, you select the image. At a range, there is flip. This is vertical. There's my vertical flip. So I just corrected my picture. Let me do that once more for the lower, because they're a vertical flip. If it was a retracted buccal mirror shot, then it's going to be a horizontal flip. Okay? Let's switch to PowerPoint, and I'll show you some differences. What you see now is my PowerPoint screen. You see a folder called PowerPoint. If I open that up, you're going to see the same thing, although there's only one version. I have two versions of Keynote, again, because some people can't run both, or can't run the newer one because of their operating system. That's going to change soon because Mac will stop supporting it. Let's open up that same file in PowerPoint.
We have another question on Facebook from Mancy. So when do you actually do this? During the comp exam, or do you bring the patient back? How long does it actually take you?
Okay, I would not do this during a comprehensive evaluation. Right. This is going to be done later. Now, what could be done at an initial exam? I'd pick the photos that I might want to talk about. I wouldn't do all this. I'd pick some images that I could use to print and show them. This is going to be about treatment planning. I'm putting things in here so I can actually create a treatment plan. That's why I'm doing that. In PowerPoint, it's a little bit different. First of all, in PowerPoint, if I want to duplicate the file, I'm going to go to File, Save As. How many of you are in PowerPoint? Okay, so everything I did in Keynote works almost exactly the same. I'll show you the things that are different. When you save your new file in PowerPoint, you have to go to Save As. When you go to Save As, okay, it's going to ask you, Where do you want to save it? So I'm going to do the current folder, but I could do anywhere. You could go find a place. You could find Craig's chart and put it in their folder and put it in there. In this case, I'm going to put it in PowerPoint because it's a test. It's going to say, what do you want to name it? I'm going to call it test. And one of the nice things about PowerPoint, as soon as I hit save, okay, it's going to ask, do you want to replace it? I am going to replace it because I did one earlier. It's going to go in and it's going to park that master back in the folder it came from, unchanged. Beautiful. This new one says test. You can see that at the top. If I want to load images in PowerPoint, the way to do that is to right-click on the image. And one of your choices will be change picture. If I hit change picture, it's going to say, okay, where do you want me to go find a picture? So it's going to go and find where I should look for pictures. In this case, I'm going to tell you it's from a file. Let's browse. There's my patient photos. It'll go to any files where you have photos in them. Patient photos. Let's go pick Craig again. Here's his initial exam. And now I can pick his smiling face, double click. Now this will, if you do it this way, it will do the same thing a media placeholder did in Keynote. It will put any size image into that frame. If you drag it in, or you just click insert and go to an image, it will do whatever size is relative to the resolution of that file. Okay? Good. So again, let me just show you, because there's one thing to show you more about this. If I go to my next slide, PowerPoint does know that I was looking to change pictures. So if I go change picture again, it'll say, okay, well, do you still want to browse? Yes. If you're going to browse, I bet you're going to browse the same place. And it always takes you back to the folder you were in, which actually makes this go very quickly. I'll double click and I'll put it in. Okay? That's one of the differences.
Can you leave that window open so you don't have to keep going back to browse?
I cannot. Not if I do it this way. And I'm going to recommend this way because you never have to resize images. If you don't mind resizing images, or you always know the size you shoot them at and they fit in your slides because you created a PowerPoint for that resolution, then yes, you could actually drag them in and then position them, kind of like we did in Keynote. I was trying to create something that would make it really easy for any image from a different camera to still fill those and have it be the same thing. That's why I created this way. If you want to flip your images, okay, in PowerPoint, what you would do is select the image, find arrange. And it means you have to look across the top, because if you're in any of these other things, you're not going to find arrange. It's in home and then arrange. When you click arrange, there's a little down arrow, click down. One of your choices is align. Align has a whole bunch of things you can do. One of them is, right? Where's my rotate? I'm sorry, rotate. Sorry. Find align. If you find align, you always find rotate. The new version, they split them. It used to be under align. You find rotate. Go to flip vertical. There it is. The neat thing about PowerPoint, I want you to watch what happens. When I click and select it and I go down here, the neat thing about PowerPoint that Keynote does not do, it shows you what you're going to do if you push the button. It does it as you get there to say that's what's going to happen. Is that what you want? As soon as you click it, it'll close and it's changed. Same thing with a horizontal change. I would arrange that, okay? And rotate. Now, why isn't it lighting up? What did I forget to do? I did not select the image. If I select the image, all of a sudden, that horizontally. We'll use this picture. If I want to put some drawings, some teeth drawings in there, let's go do the same thing. There is one little difference. It is a left click, and you must totally surround whatever you want to select. If you don't, I want you to notice that I'm touching lots of teeth here, but the only ones I'm surrounding are the 6 anteriors. They are the only ones that will select. Okay? When they select, I can then copy them, Control-C, because there is no Command key on a PC. And I'll use this one to put them in. It will be too small, but Control-V, paste them in. And then we can do the same things exactly that we did before. Okay, now, that's an aesthetic treatment plan. What it does is give me ideas about things that I could do with teeth. I am going to show you just on the screen that all of the 4 areas, appearance is aesthetics, function, structure, and biology are here in those slides. so that as you're treatment planning, you can add slides and make notes for yourself. So I can put a new blank slide in, go in and put a text box in and start typing notes for myself. The idea of this is that you could use this to sit down and actually treatment plan what would be a good therapy for that patient based on your evaluation, examination, and your photography. I'm going to talk about how to use these, so I'm going to be leaving the demo. For those of you on Facebook, we're going to be saying goodbye. If you go to our website, actually, can you go through the Facebook link? There's a link on Facebook where you could actually go in and you can get a link so that you can actually watch me do this. I have 2 videos, one for PowerPoint, one for Keynote, that would be completely accessible to you. At those videos, you can actually find a way to link up with me and ask me to send you a Dropbox link that would allow you to download everything you've seen today in Keynote, PowerPoint, or both. Thanks for being here, Facebook people.